welcome to this short video on how to do your dressing at home. There are times when your health professional will believe that you have the ability to do your own dressing, and so the purpose of this video is to assist you and guide you in how to do your dressing at home. They would never ask you to do a dressing if they didn't believe that you were capable of doing it. So there are times when the dressing must stay dry and you'll have to put a plastic bag on your leg, and other times they'll say, no, take the dressing off and have a shower and wash it in the shower. So we'll have a look now at how to apply the dressing and how to clean the wound. The first thing is that after you've had your shower and got yourself dressed, you would put some antiseptic on your hands. So just like for this virus right now, we're concentrating on hand care, we're also concentrating here in making sure that the hands are clean. So you'll have your sanitizer. You'll have a cleaning solution, and sometimes that's a special solution and other times it's just normal saline that's used to contact lenses, etc. The health professional will tell you what cleaning solution to use. A dressing tray is often used because you've got forceps and swabs and gauze, etc. And then we have the dressing product that the health professional has told you to use. There are many in this particular brand that I'm going to be showing you. So there's a Sorbact with an absorbent pad and a Sorbact with foam, and then a waterproof Sorbact, and it comes in rope and ordinary plain sheet form. So you've got your dressing that they asked you to get. So the first thing is open up your dressing tray, pour your cleaning solution in, which I've already done, and then open up your dressing and have it out ready so that you can do all of these things with clean hands. So there's our dressing ready. Now, because we've touched all these things, we're actually ready to go in on the wound itself. So again, it's hands. So do your hands again. Any forceps, it doesn't matter. Nurses nearly always use the yellow one for the first cleaning. So you'll take a piece of your gauze or your gauze swabs, dip it in the solution, and take it around the outside of the wound. Of course, your wound has been your leg has been dried after your shower, and you're cleaning the outside of the wound. Take another one and clean the wound itself with a good circular motion. You're trying to lift off any residue and crusting and scabs and any old dressing, etc. So good clean on the wound after you've done the outside. Then you can take another one of your swabs and dry all the outside of the wound. So now we're ready to think about the dressing we're actually putting on, and this particular dressing is our Sorbact waterproof. Now sometimes you're not allowed to have a waterproof dressing, and your health professional will tell you which dressing to use. Know that many dressings have two forms to them. So this particular one has the backing sheet only. There are other dressings that have a front sheet as well that you have to remove. Remove half of the backing sheet, and because we've dried the skin beautifully around it, we now place it on knowing that you've got most of the green over the wound. Lay it down, anchor it, peel it back, and peel off the rest of the dressing and secure. Now, if you press it all down really, really well, you actually can see the colour of the skin coming through the dressing, and this has got a really good seal. So this is a waterproof dressing with an antimicrobial component in the green. Then you would take your moisturiser and moisturise your leg, and depending on what the health professional said, you may have one tube to put on your leg and protect this, or you may have a tube and a compression type tube like Tubi Grip or something. If you don't have the sealing waterproof dressing and we're just using a plain pad with no adhesive, then you would definitely have to have the two sleeves, one to hold the dressing on and then the second to squeeze some fluid out of your legs. Once you've finished, you obviously pack up everything, do your hands again, and this dressing, the health professional will tell you, usually lasts 2 to 3 days. If you've got pain, redness, swelling, lots of ooze coming off your wound or your dressing's not sticking properly, you should get back in touch with your health professional. Thank you, and I hope that this has been helpful and giving you reinforcement to feel secure and safe doing your own dressings at home. It is just being practical, having all your equipment ready, having a clean environment to put everything on, and your hand sanitizer.